So speaking of which, here is that reflux esophagitis here. So that there is that itis word. So this is going to be the inflammation of the esophagus. And the reason why it's due to all of that acidic chyme, which we haven't introduced this word just yet, but chyme is going to be what happens to the bolus of food when it mixes with gastric juice. So it's going to be when that chyme starts to reflux or go back up into that esophagus. And usually you have that pain that's right behind the sternum, and that's why this is typically known as heartburn. Sometimes people think that they're having a heart attack, which it's weird because this happened to my mother-in-law this past Easter weekend. She thought she was having a heart attack, but when she got to the doctor's office, it's just a really bad case of heartburn. So sometimes it can be really, really intense. It can be pretty painful. This is typically seen in individuals that are overweight, smokers. This can happen a lot if right after extremely large meals where the stomach is a little bit larger than it needs to be, so it can't completely close off. Or if you tend to eat dinner late right before you go to bed, then that can also cause heartburn. So that's another problem. Please make sure that you eat at least 2 hours before going to bed. But another thing, this occurs more often in individuals that have a hiatal hernia, which remember I just introduced that a second ago and I talked about that, that hiatus there. And the reason why, remember I just talked about how the diaphragm is going to contract a little bit right there around that lower esophageal sphincter to help close it off from the materials of the stomach. So if an individual has a hernia, which is it's basically because you have a weakening of the diaphragm, and that hole opens up a little bit and the stomach protrudes up. So that is going to be why that happens. So in order to avoid this, of course, I talked, lose weight, stop smoking, don't eat such large meals, go to bed a little bit later than you do, or eat dinner a little bit earlier. Sometimes they suggest to elevate the head a little bit. And that is going to kind of not let gravity take effect, or I guess it would let gravity take effect, because if you're laying like this, then the contents is more likely to kind of seep through. And also let's talk about GERD, or gastroesophageal reflux disease. So this can result from what we just talked about, a chronic case of that really bad heartburn or chronic reflux esophagitis. And what happens is that because you have this acidic chyme that is constantly going up into the esophagus, it's going to completely erode the esophageal tissue. What happens is two things that are not good. Scar tissue forms, and so that is going to lead to a narrowing of the esophagus. But also that stratified squamous tissue that you have there in the esophagus is going to change to columnar tissue. What it's doing, and it's secretory. It's secreting a lot of a bunch of mucus that is trying to go in and protect it from the acidic chyme, which is not what we need in the esophagus. We need stratified squamous epithelium. There is a reason why we have tissues in certain organs, and it's because of their function. So because you have this changing of tissue, which is not good, you have an increased risk of cancerous growth, because if you think about it, what cancer is, it's kind of a changing of a tissue from one thing to another. There's a lot of different medications that can be used to treat GERD. There's some proton pump inhibitors. These are things like your Prilosec or your Nexium. You also have some histamine blockers as well. So those are some good ones too. And you can always take the antacids, right? They are going to go in and block the acid, or not block it, but neutralize the acid.